Hey. It is Dr. Kre. Thank you for joining. Come on in the room. Come on in the room. Come on in the room. This is our latest installment of the Dr. Kre and Me show. This is September. I can't believe that September is almost over. And we are actually celebrating, or I guess not necessarily celebrating it, but we are commemorating we're actually commemorating, hey Alvina, we're commemorating Blood Cancer Awareness Month. Hey Michelle. So Blood Cancer Awareness Month is September. And it's interesting that we've had all the findings that we've had with my dad in this month because it is Blood Cancer Awareness Month. So I wanted to share some tips with you guys on how to know about what to know about blood cancers. We're going to talk about leukemia tonight. So have y'all been having a good day? Albina and Michelle, we're going to get together. We're going to get started in probably about 3 minutes. Hope you've had a great day. Albina, I'll be checking on you, checking in with you soon. It's been a couple of days since I checked in, so I have to stay on my job. So it is September 25th, and thank you guys for sending messages. Hey Keisha, thank you guys for sending messages to me about thank you guys for sending messages to me and inquiring about the new practice plans that we are having and that we're doing. What is the no for, Avina? Hey Pam, why you say no? And people have already started to sign up, and we're very excited. I know that it is interesting. Hey Maggie, interesting in an adjustment, but we make the adjustment. We have to move with time. We actually have to be before time. So we're gonna get started because Zoe has allowed me to be down here. She's found the vent. Hey Ava, she's found the vent and she can talk through the vent down here, downstairs. And she's like, I hear you talking. So I was like, you can listen, but you have to listen upstairs. So you know how we have to do it. Anyway, I'm going to get started. You know who I am. I'm Dr. Kre. I'm a board certified family medicine physician, and I specialize in what's important to you. Through my awesome practice here at Brownstone Total Family Healthcare, yes, we're making changes, but they're going to be great changes. Through my practice, Brownstone Total Family Healthcare, through telemedicine, hey Trina, through my awesome Dr. Kre and Me show, I help you live healthier, happier, whole lives. And I want to help you just feel better, live better, learn more about yourself, love yourself, because I feel like when you know better, you can do better. So we're going to get started, and tonight we're going to talk about blood cancer awareness. A lot of you may have seen my post. My dad was diagnosed with leukemia earlier this month, and I wanted to make sure to tell you guys because it was kind of a random thing. Well, I believe in God, so I don't believe that there are things that are random. I really believe that it all was kind of divine the way it happened. But I want you to know, because it was such subtleties that happened. I'm not going to have a whole bunch of points tonight. If you find points that you want to post, then feel free to. But I want to make sure to tell the story of my family tonight so that you guys can know some things to be looking for. Hey Tashima. So on the end of August, my dad went in for a upper GI. Nothing out of the ordinary. He's been feeling fine, hadn't had any problems. He went in for it, came out faster than I had expected because he does everything in my hospital, so I can run back and forth to get things done. I can see patients and I can check on him. So he goes in. I came back over to see him. He was done. Everything had gone well. He had some precancerous cells on his esophagus because he has really bad acid reflux. So his doctor called and was like, hey, everything looked good. Everything looked really good on his scope. Even can't hardly even see the precancer changes. What a blessing. We're thinking all is well. So the very next day, we schedule him with his primary care physician. Primary care physician goes on. He sees him. He texts me the next day. Oh, everything looked good with your dad. He is a diabetic. He knows I'm telling his story tonight. He should chime in, so this is not against HIPAA. So he comes in and says everything looked good. He looked good today. His blood pressure was good. Make sure he exercises, loses some weight. They always say that. Whatever. You'll get to his labs in about 2 days. So 2 days later came, his labs come across my desk just like a lot of you guys I see. They come across my desk. So I'm like, okay, everything looks good. His A1C looks good. His kidneys look great. His liver look great. And I get to the very last lab, which is what's called your CBC. Somebody put in there the chat CBC, Charles Bailey Charles. So his CBC came back. Everything looked normal except for his white count. So the white count is what is high when you have an infection. So you want white cells to be high one time, you want them to be low another time, normal another time. And in African Americans, they can tend to be lower. So a normal number is 3.5 or 3,500 to 10,000. That's a normal number. So sometimes in African Americans, we see lower than normal. So yours may be 3,000. That's okay. Yours may be 2,700. We may say, come on back in. Let's recheck your levels. Let's make sure we know what's going, just make sure nothing's going on. Make sure that level goes back up. Goes back up to 3,500 to 3,000. Oh, if it continues to go down, we may say, hey, go see the blood doctor to make sure there's nothing else going on. Or may pick up the phone and call a pathologist to say, can you look at this blood to make sure we're not missing anything out of the ordinary? So, in Dad's case, his number was 18,000. And because, unlike a lot of men, he goes to the doctor 3 times a year, his last number 6 months ago was 10,000. So it was totally normal. Nothing out of. So I'm like, 10,000 to 18,000, that's a big old change. So immediately I get on the phone with his doctor. I'm like, hey, did you see Dad's numbers? His number went up 8,000 points in 6 months. But maybe it was because he had his scope the day before. Sometimes they give you anesthesia. That can make your white count go up. Infection can make your white count go up. If they nick the place, anything. So we're trying to figure out, hey, it is likely that it was something that happened the day before that caused this. We send a lab to his stomach doctor, and his doctor's like, let him repeat it in 2 weeks. So when a doctor calls back and says, you need to repeat your labs in 2 weeks, we mean that because we've seen, oh, Dad's here. Hey, Dad. We mean that you need to get your labs repeated in 2 weeks. Like, we mean that. That's not like, oh, I'll get around to it in a month, or I need to come in a week. So his doctor was like, let's repeat it in 2 weeks. And I'll just, by the way, have the lab the pathologist look at the lab and see if it's anything. It probably is not anything. Oh yeah, it's probably not anything. So I get on the phone, call my dad that night. I'm like, Dad, it's probably not a big deal. The number's up. You may be starting to get a cold. So colds can make that number go up. Infections can make that number get up. Steroids, if you've been on steroids, go to American Family Care, get steroid shots, get your labs. You're like, oh my goodness, that number can be up. But that's a acute reaction. It comes back down. So immediately they go and 2 days later they come back and say, hey, the cells look suspicious for chronic lymphocytic leukemia. Somebody put in there CLL, Charlie, Larry. So immediately they're like, oh my gosh, this is very suspicious for chronic leukemia. So I'm like, okay. Well, I already gave my dad this pep talk the night before, and I'm like, oh, it's probably an infection. It's probably whatever happened. And I had an aunt to have leukemia at a very early age. She had the acute leukemia. She had AML, so Alpha Mary Larry. So she had acute leukemia. And it had to be nothing but God for me to go down that road with him and say, well, Dad, you know, and see, Brenda she had leukemia. So we probably, with that history, we probably need to run some more tests. Hey, Lakedra, we probably need to run some more tests and make sure that it's not that. It has to be on our radar. But usually numbers are much, much, much higher if you have, you know, that kind, you know, off if it's leukemia. So that was a Thursday. Friday morning, I get the call from his doctor. He was like, yes, the slide came back. Hey, Velmika, very suspicious for chronic lymphocytic leukemia, which means his white count was way too high. His bone marrow is making all these white cells. Hey, Dad. So making all these white cells, producing white cells faster than they should. So I'm like, oh my goodness, you know, what is this? So call and the doctor's like, you know, hey, it's probably not a big deal. We need to talk to the oncologist. Get on the phone with the oncologist. The oncologist like, well, if that is one to have, that's one to have. You know, because they tend to live longer lives. They tend to have very little symptoms. By this point, Dad didn't have any symptoms. He's like, I don't even have a cold. I'm not coughing. I'm not sneezing. I'm not doing any of this. So I'm like, okay, it's probably not that. So we come back. We go on our anniversary trip the very next day. We get this news on Friday. We go on the anniversary trip the next day. He comes to see us on Sunday so that he can have his test on Tuesday. So they drew more blood work to specifically say, yes, if this is leukemia or if it's not leukemia. So let me just pause and say, do you not see the importance of going to the doctor and getting your blood checked? Had he not gone out and got his labs checked, and had he not somebody being an advocate for him, I saw the number and was like, okay, Lord, let's look into this. So have a good doctor. Trust your doctor, a doctor that you can trust, because you want to know that if something's going to come across, that they're not going to just sweep it on the rug. They're not going to just be like, oh, let's just recheck it in 6 months. It's a no. So I'm just so very thankful that I saw it, and then I was like, okay, something's not right. We have to do something. You know, we have to look into this. So took 7 days or so. It's a lot of waiting in this game. So now we're at last week. And I called the doctor. I'm like, no one said anything about these labs. He was like, oh, yeah, we got them last week. No one's called you? Oh, no one's called me. So I went on the other side of the coin. It's hard being a patient. I have learned that you have to just sit there and wait. You can't make things happen. You can't make the people look at your labs any faster than they do. You just have to wait on the time. So we actually got in to see got the results on the Thursday. Went home for my grandmother's best friend funeral, and then after the funeral that night, was able to tell him that yes, that's what confirmed it. And no one wants to ever give bad news, and you definitely don't want to give bad news to your parents. Okay, so it really has helped to show that it's just opposite. It's hard on the other side. So I really admire you guys for being the patients, taking on whatever the news is, and hopefully whoever's delivering the news is giving you the news the way you need to be can be received. So prevention, yes, Alvina, prevention is the key. So we get there, we go see the oncologist. Oncologist is like, yes, do you know why you're here? And my dad is very stoic. If you guys do not know him, he is a pastor of 30-something years. He's a educator, very stoic. We're in there. All of us are there. And we're laughing. We're joking. Trying to make the mood light. And he's looking like, if y'all don't shut up and hush, my heart's about to be out of my chest. So the doctor comes in, asks him, did he know why he was there? He said yes. He knew that, he was there. He had CLL. And that the doctor turned around and said, yes, you have CLL, but it's stage 0. That is what prevention will do for you. That is what getting checked will do. You can find things out earlier. You can find things out sooner. You can know at stage 0 and not necessarily at stage 4. So I'm just so thankful. So stage 0 means that he has the evidence of a leukemia in his blood, but he doesn't have any more symptoms. So we were so thankful that the timeline is 5 to 7 years or more before he would have to have any kind of chemo or have to take any medication for the cancer. So prevention is the key. That's number one. But the second big point is having someone that's an advocate that's gonna be like listening to their good. Make sure that whoever you're seeing, they're listening to their good. They have a line with somebody, you know, that they're higher power, they're supreme, that you like, I need to listen to my good. So I'm so thankful, so very, very thankful that we went on ahead and looked, and Dad has been awesome. Not been sick. So what do we do from here? You get this diagnosis. What do you do other than kind of internalize it? You have to have all of your vaccines. So he immediately got pneumonia vaccine, immediately got flu shot, and he has to get the new shingle shot. There is a new shingle shot. Hey, Tracy. There's a new shingle shot out there. It is not a live vaccine. Hey, Keisha. Not a live vaccine. So it is less chance of making him sicker, because you get a live vaccine, you can't get sick. So he has to get the shingles vaccine, which is 2 doses now. Zostavax is the old one, but it's hard to find. They live in, the black belt. The shingles vaccine is not around. So you have to make the best out of your situation. So we are at stage 0, leukemia. Get your vaccines, and he has to stay healthy. He has got to stay healthy. He can't be going to the doctor visiting all the church members when they get sick. That's my prescription. That's my prescription to him. He has to be able to stay clean, stay healthy. The flu can kill him. Pneumonia can kill him. Things like that we take for granted are things that now are health, hazards and risks for him. So he's a pastor. He's dealing with all of this. You looked whooped down. I'm tired. You missed part of the whole journey. Okay, so Dad has to get these vaccines, and then we don't have to see the oncologist for until the numbers get crazy. So if you know my dad, make sure to encourage him. Let him know that we're so thankful that prevention is the key, that he's gone to the doctor like he's supposed to be going. What we want our pastor, yes, prevention is the key. Having a good physician advocate. Get your vaccines. So that's chronic leukemia. My aunt had acute leukemia. Acute leukemia is a whole different ballgame. That is when your bone marrow stops producing the cells the way they need to. So his white count was 18,000. Hers is like 2,000. So her iron is low, her hematocrit is super low, her platelets is low. You can't fight infection on this spectrum. And they're not like, because she had one, he has this. They're not where they are, it's not supposed to be hereditary. I guess it's just a fluke that he has one kind of leukemia and she has the other. So we have to be mindful that things run in your family. Z5 Fred. Oh, see, he on here tonight, Keisha. He's watching too. Dad got diagnosed with leukemia last week, so I'm telling a bit of our story and how we got there. But a lot of it was because something looked wrong to me and to his doctor. We collaborated and jumped on it. So I'm like, okay, Lord, if this is why you had me to become a doctor, to make sure my dad got this diagnosis early, I'm good. I can retire, okay? I can retire. I've done what you called me here to do. So I'm just thankful, so very thankful of that. So anyway, so we have to know that there's 2 different types. Acute leukemia, that comes on really fast. You end up having a shorter lifespan with that. My aunt had to be really young. She may have been in, I think, maybe 30s or early 40s. I was little. I was in middle school when she got diagnosed, and I remember them driving from Mobile to stopping at our house halfway point to driving to Vanderbilt to get, which I thought was amazing. She was going to Vanderbilt to get all this treatment, like all of my aunts and everybody got their bone marrow tested, because the only cure was to have a bone marrow transplant. Anyway, I think she ended up getting a transplant, but she still ended up dying pretty quickly after having a diagnosis. The good thing about what Dad has is that he can live a long life, but he has to be careful. He can't be out here doing all this stuff that he's been doing. He's a teacher, so he's around sick kids. Their kids gonna be sick. So we have been petitioning my mom to let him retire. But he's gonna be looking for a part-time job, so somebody go out and find him something to do, okay? So he don't have to be home every day. But make sure that you prevention. That's the big thing. Go to the doctor. Go to the doctor. Get your labs checked. If something is wrong, go get them checked again. If the doctor recommends you going to a specialist, go see the specialist. Do not say, I don't want to go to all these doctors. I just want to go see one doctor. That's not good all the time. That is not good all the time. So, hey, Cassandra. So that's pretty much what I wanted to share. I wanted to kind of let you know that I'm human, that things happen just like you're dealing with your stuff, and I'm trying to educate you on what's what. We're human too. We're dealing with this, and learning all about the new vaccines and new things out here to make sure he stays as healthy. And take some turmeric. Turmeric is what we found out that is full of great antioxidants. It's a great herb. It helps with inflammation. It helps with combating free radicals, which is something that is out of whack when you have cancer. So that is on turmeric now. Go get some turmeric. You can get it from the health food store. You can get it from Walmart. You can get it from wherever you want to get it from. And as long as it's 500 milligrams. So, hey, Famu. So make sure that you take care of yourself. Go to the doctor. Ask the doctor about your labs. If you go to Brownstone, I'm not calling you if your labs are normal. But if they're abnormal, something's up, I'm going to call you. So know what your doctor's rules are. Sometimes doctors like, I'm not calling you at all unless you're dying. Okay, that's scary. Whatever. But that's it. I don't have really mean a whole lot of posts. Thank you, Dad, for joining tonight as I kind of help use your story to as a testimony to allow people to know that you got to get taken care of. And when in doubt, get a second opinion. I don't think any doctor is going to be upset about that. If you don't know, ask again. Let somebody else look at your levels. Hey, just look at it deeply. So we have ALL, leukemia. We have CLL. ALL is acute. 5-year prognosis is about 20%. CLL is chronic. You can live a long life. 5-year prognosis is 85 to 90%. So they're two totally different cancers. One, you have a lot of white blood cells. The other, you don't have as much. So I want to make sure that you guys know and get checked out. Like, there's nothing better to do other than getting checked out. So get checked out. Go see your doctor. Sign up for the new Brownstone. You're welcome, Dad. I love you so much. And I'm so happy that we were able to find out what we have so far, and that you're telling people and you're allowing people to learn from your story, and that you use this for the better. I'm going to get out of here because Zoe has let me do this, and she hadn't come down here. You know who I am. I'm Dr. Kre. I'm your board certified family medicine physician. Hey, Derek. Catch up on it. I was telling my dad's testimony. He got diagnosed with leukemia last week, and I wanted you guys to know what we went through so that you know what you need to be looking for. But anyway, I'm Dr. Kre. I'm your board certified family medicine physician. Thank you, Alvina, for taking notes. I'm a board certified family medicine physician. I specialize in what's important to you. I want you to know better so you can do better. I want you to live long, healthy, happier lives. And if you don't remember anything, go get you some turmeric, 500 milligrams. Take that for your support, general health support. Thank you, guys. I love you, and I will see you guys in 2 weeks. Take care. Oh, check me out. Follow me on Instagram at Dr. Kre. That's DOCTORKRE. Thanks.